Students, then we are going to learn about the nervous system. Before going to the disease condition, it's important to learn about the anatomy and physiology. To study anatomy and physiology, we help for us to learn the issues is finished. So let's begin to learn. I make everything more simple and easily understandable, so no need to worry about this. Let's make and make this. Okay? Let's start. Then is the immune system. The short names are included into the system. In our nursing school, we already studied about the prayer of kidneys, urinary cells, urinary bladder, and urethra. Let's mention technique to eliminate and restrict the waste products, information fluid, a kidney will be dispersed from the urethra to the urinary bladder. The urinary bladder is called the reservoir of fluid by the venous it collector. Then there is a urethra, which is the outside urinary bladder that is passed to the urethra to the hydrometus to outside, and it's called as maturation. So we need to study about the functions of kidneys. First, we learn about the structure, then regarding the shapes. I just made it simple and just learns a bit better. Actually, our kidneys are acting as a washing machine. The purpose of a washing machine to eliminate and explain or clean the clothes, isn't it? So, it's the same for in our body, kidneys are function. They are eliminating the waste products and clean our body. So the first thing is acid-base balance. So acid-base balance, the kidney maintains our acid-base balance in the body, which can split the H plus ions or hydrogen ions and maintains the bicarbonate level. If you think a person with a kidney disease will have the higher bicarbonate level or lower bicarbonate level, yes, they always have a lower bicarbonate level, which means acidosis. A person with acid kidney always have acidosis. Then water contains to lower electrolysis, toxin removal. Then blood pressure control, electrolyte balance, vitamin D activation. In here, there is a waste removal or waste removal bar. In the one, that is blood urea nitrogen. In our body, kidneys act as an waste removal or water removal either. In which, if the water is accumulated in the body, what happens? Yes, fluid accumulations. And what will happen if waste accumulates, that is urine, creatinine, and accumulate in the body, which may result in uremic encephalopathy, which means urea and creatinine in the blood will be there in our body, which affect the brain also. Then alcoholics. Person with chronic kidney disease are always have anemia. That is so it's wrong because the kidneys are not enough to produce their hemoglobin. Then blood pressure control. There is another hormone in produced by the kidney as renin, which is responsible to maintain the blood pressure. So when the kidney is not properly functioning, what will happen? The blood pressure will be rising. It is not controlled. So it is where chronic kidney disease, the blood pressure should be called as high. Then electrolyte imbalance with vitamin D activation. So when vitamin D is not activated, which may lead to there is a loss of minerals and vitamin deficiency, especially which may affect our bones also. Then the research is of service. Whatever like the risk of mistlacks, chemical exposure, complex also primary history with current use. Current use this by limiting cost of large bronchitis or bronchitis. Then failure. The heart failure affects our kidneys. Yes, that we studied in our kidney injury. There is a renal cause which affects the blood flow to the kidneys are obstructed. Then what happened? The perfusion of kidneys was which may result in renal damage. Then medication, traumas, neurovidiasis and nephrovidiasis. What do you mean by vidiasis? Vidiasis, the word means that storm. So neurovidiasis is storm in the form, or nephrovidiasis is storm in the kidney stones. Then pH and the fluid balance, as we already mentioned that calcium level in the kidney patients is very high. When there is a lack of coordination or balancing of the potassium due to the deficiency or the malfunction of the kidney, then the pH level is always considered acidic. When we put an individual of a patient that this always seems to be acidic. Studies, which are example, seven related. That's it. These are the standard studies. The sediment function test are of data. All things are important. The acid, urea, uric acid. All this can be called as combined bacterial pressure. That is 8 to 25 when I create it. Then let us discuss the performance system. This robotic injury. What can be kidney injury? Kidney injury is a rapid loss of kidney function, results in blindness, but it is a reversible condition. But possible, it can be reversed by one original condition by connected treatment and early recognition. If it is not happened, this may lead to an chronic kidney disease. Let us discuss regarding the pathophysiology. The topic is very simple. So let us discuss that due to the renal damage. It suddenly goes expansion. It's not cells that goes in its liver. And if this condition is not treated, this may lead to chronic kidney disease. So the pathophysiology is actually the baby is same for both AK and the CK. But if the AK is not treated, but it just leads to severe attacks. Then the causes. I already mentioned how a heart problem with the kidney. There is a six three causes for the acute kidney injury. One is pre-renal cause. The pre-renal cause, which means the pre-renal cause. Here we can see the pre-renal cause. What is the cause of pre-renal? Invariant respiratory depression or dehydration, decrease the cardiac output, decrease the performance blood systems, or decrease the blood flow to the kidneys, which means this portion of the kidney is now responsible for the pre-renal. This portion, how it is affecting increased blood flow to the kidneys or because perfusion to the kidneys was related to the pre-renal. The next one is the infrarenal. What in the infrarenal is the things that happens here. It is the infrarenal first. Other things are prolonged renal ischemia, intrarenal infections, or obstructions. Then next one is post-renal. Post-renal means this happened. Okay, post-renal bladder injuries or obstructions, bladder cancer, or post-renal infections. So I hope it is understandable for you. The causes are renal and the portion below, and infrarenal and post-renal. Okay. Then the stages of it, kidney injury. So all are the stages of kidney injury. As we already know regarding that, the stages. First one is oliguric phase. What is oliguric phase? Oliguria means urinary output is less than 400 ml. That is the proteinuria is excess in the body. So this relates to public acidosis, legislation, thinking, necrosis. So the management is here. Glasses, taken basis, glasses is also mass, personate, and for some reason, the olectic. Then, restrict fluidity. Fluid phase means fluid output is less, the body body is activated. So we need to restrict the fluid. That is important. That's the management. Then diuretic phase. What in the diuresis? Diuresis means extra phase. Urinary output is about 5 liters. Normal urinary output is about 1.5 to 2 liters. So urinary output becomes 4 to 5 liters, which may lead to diuretic phase, which indicates the damage to nephrons. Is it clear for you? Then regarding the recovery phase. What then, right? Recovery phase. Recovery phase is a slow process. It takes up to 2 years. So it takes up to 2 years. In the recovery phase, the urine volume becomes normal. Okay. For the diuretic phase, what we do? That fluid is excessively eliminated. So we lead to dehydration. So what we do is the IV fluids and electrolytes replacements. Okay. Is that clear? First phase is a recovery phase, second one is an diuretic phase, and third one is known as a recovery phase. In the recovery phase, luminary liquid is lost, and a diuretic phase, luminary liquid is lost. So we do instead recovery phase, it is the kidney become normal. Right. Then nephrotoxic medication. What do you mean by nephrotoxic medication? The medication which may adversely affect this. Here also there is some cause of kidney disease. So we make sure the cause of kidney disease. There is a causes that is nephrotoxic medications, antibiotics, NSAIDs, non-pharmacological agents such as pesticides, heavy metals, or poisoning of mercury, which may lead to the burns, acute kidney injury. Then next is the phases or lab findings. In each phase, there is certain lab findings also. In the oligomer phase, which is last only for 8 to 15 days, 8 to 15 days. So in this phase, the urine of the first side is less. Then second side is elevated bundle, that is elevated blood urea.